Sauna is not just sweating, it is a stress dose. Too little may do nothing, too much can be dumb, and if that sounds harsh, remember, sitting in a wooden oven trying to prove toughness is not automatically a longevity strategy. The goal is not to see who can suffer the longest. The goal is to use heat as a controlled, repeatable signal that trains the cardiovascular system without turning recovery into a medical incident. Sauna is not magic, it is not detox, it is not a replacement for exercise. It is best understood as a hormetic stressor, which means a small controlled stress that may help the body adapt. That is the sweet spot. Enough heat to create a useful challenge, not so much heat that you stand up dizzy, dehydrated, and suddenly very interested in the floor. The strongest evidence is still for traditional Finnish-style dry sauna. Infrared sauna may be useful and more tolerable for some people, but the classic longevity data mostly comes from traditional sauna bathing, not every heat gadget with a Bluetooth app and a dramatic product page. So let's build the longevity compass sauna protocol. How often, how hot, how long, how to hydrate, how to cool down, and who should be careful. First, why sauna is interesting. When we sit in heat, heart rate rises, blood vessels open, sweat increases, and the body has to move blood toward the skin to dump heat. In some ways, the cardiovascular system is doing a low to moderate stress rehearsal. This is not the same as training your muscles. Sauna will not replace squats, walking, cardio, or carrying groceries in one heroic trip because we refuse to make two. But sauna may pair well with exercise. Think of it as the side quest that may support the main quest. The famous Finnish data followed more than 2,000 middle-aged men for about 2 decades. Men who used sauna more frequently, especially 4 to 7 times per week, had lower rates of fatal cardiovascular events and all-cause mortality compared with once-weekly users. Important wording: associated with lower risk, not proven to make us immortal. The Finnish data do not prove sauna as a cheat code, but they do suggest that consistent sauna use is not just a spa ritual. It may reflect a meaningful cardiovascular resilience habit when used safely. There is also a blood pressure angle. Frequent sauna use in Finnish men was associated with a lower risk of developing hypertension. And acute sauna studies show that one hot session can lower blood pressure temporarily and reduce arterial stiffness markers. That sounds great, but it is also the safety warning. The same mechanism that makes sauna interesting, blood vessels opening and pressure dropping, can also make it risky if we are dehydrated, over-medicated, overheated, fasting too aggressively, drinking alcohol, or trying to impress absolutely nobody. So here is the beginner protocol. For the first 2 weeks, start with 2 sessions per week, 5 to 10 minutes per session, at tolerable heat. Do not start with the hottest room and a 30-minute warrior ceremony. Your first goal is not optimization. Your first goal is learning your response. How does your heart rate feel? Do you get lightheaded? Are you breathing calmly? Do you recover quickly? Do you feel better afterward or wiped out like your mitochondria filed a grievance? The standard LC protocol for many healthy adults is 3 to 4 sessions per week, 12 to 20 minutes per session. That is enough to be consistent without making sauna your second job. It also fits the pattern of the evidence without telling everyone they need daily heat exposure to be worthy of health. Advanced users who tolerate sauna well may build toward 4 to 7 sessions per week, usually 15 to 20 minutes each. But advanced does not mean 45 minutes of suffering. If the session becomes a staring contest with your own common sense should win. Now temperature. Traditional dry saunas often run hot, commonly somewhere around 158 to 212 degrees Fahrenheit. A classic Finnish-style sauna may be around 175 degrees. But beginners should start lower and build slowly. The goal is not to chase the hottest room in the gym like it is a character test. A good session should feel challenging but controlled. You should be able to breathe calmly, stay mentally clear, and exit before symptoms force the decision. Now hydration. The goal is not to leave the sauna lighter. That is not fat loss. That is water loss asking for a refund. Hydrate before, rehydrate after. If the session is longer, repeated, stacked after exercise, or you are a salty heavy sweater, electrolytes can make sense. Sweat is mostly water, but it also contains sodium, chloride, and other substances. If you are dripping heavily, especially after training, water alone may not always be enough. But do not turn hydration into a gallon chugging contest either. Too much water too fast can dilute sodium and create its own danger. Sip. Replace. Be boring and intelligent. A simple practical rule is this: drink water before the session, keep sessions reasonable, then rehydrate afterward with water and electrolytes if the sweat dose was meaningful. Now cooling down. After sauna, cool down gradually. Sit for a minute, stand slowly, breathe normally, rehydrate. A cool shower is recovery. A cold plunge is a separate stressor. Cold plunging is not mandatory, and for some people it is not wise. Cold water can cause a sudden increase in breathing, heart rate, and blood pressure. That is a very different signal from sauna. Do not turn one stress dose into a double dare. If someone is experienced, healthy, and has clinician clearance when needed, contrast therapy may be something they enjoy. But it is not required for sauna benefits. Now the biggest myth: detox. Sauna is not a detox machine. Your liver and kidneys are the detox department. The sauna is more like the cardiovascular training room. Sweating helps regulate body temperature. That is its main job. Yes, tiny amounts of certain substances can appear in sweat, but forcing excessive sweating to cleanse the body is not the reason to use sauna. The better sauna story is circulation, vascular function, relaxation, heat adaptation, and stress resilience. Now who should be careful? Avoid sauna or get clinician guidance first if you have unstable chest pain, recent heart attack, serious heart rhythm symptoms, fainting episodes, severe valve disease, poorly controlled blood pressure, very low blood pressure, dehydration, fever, acute illness, or serious heart issues. Pregnancy is also clinician guidance territory, not YouTube protocol territory. If you are sick, skip it. If you have a fever, skip it. If you are dehydrated, skip it. If you drank alcohol, skip it. If your body is already under stress, do not add heat just because a podcast said hormesis. More stress is not always better. Sometimes more stress is just more stress wearing a wellness hat. Stop immediately if you feel dizzy, faint, nauseated, confused, chilled with goosebumps despite the heat, unusually short of breath, chest pressure, pounding irregular heartbeat, severe headache, or if you stop sweating and feel overheated. That is not weakness, that is data. Now here is the simple weekly plan. Week 1 and 2, 2 sessions per week, 5 to 10 minutes each. Hydrate, avoid alcohol, and learn your response. Weeks 3 and 4, move to 3 sessions per week, 10 to 15 minutes each, if tolerated. After week 4, most healthy adults can aim for 3 to 4 sessions weekly, 12 to 20 minutes each. Experienced users can consider 4 to 7 sessions weekly, but only if recovery, hydration, blood pressure, sleep, and energy are all still good. The best sauna protocol is not the most extreme. It is the one you can repeat without drama. Here is the quick checklist. Do sauna after training or on recovery days. Start shorter than your ego wants. Hydrate before and after. Use electrolytes when sweat loss is meaningful. Cool down gradually. Avoid alcohol. Skip sauna when sick. Do not chase detox claims. Track blood pressure if relevant. And leave before the sauna makes the decision for you. If this helped you build a safer sauna plan, tap like, subscribe to Longevity Compass, and check the description for our Amazon KDP book and helpful sauna tools like electrolytes, a water bottle, blood pressure monitor, and heat session tracking gear. Because longevity is not about proving we can suffer. It is about choosing the right dose of stress, recovering from it, and coming back stronger.